Yeah, and I just say I can recall many patients telling me in my career since I've been here that, wow, you must have some kind of hiring criteria. I think, and I've talked to fellow managers, I know Kerry about this in the past. I do think there is something special about our teams in regards to sort of, Kerry mentioned it before, like passion with what we do. But it's not only passion, it's really incredible dedication to meeting patients' needs. That really, if you just look at, in my own profession, physical therapist, it's like it takes a special kind of person to really choose to do this type of work day in, day out, and to bring their best every day and to do that. And we are so fortunate because both of our teams really are so dedicated, and we see that in the outcomes of the care for our patients. All of our team in the rehab space have additional certifications. Some of us have more than one. Some of us have one, but that just demonstrates and shows that the skill level required to treat patients optimally takes this additional training and this additional certification. And really, again, what those certifications do is they allow us to really be those experts in that oncology sort of foundation and understanding. How do we apply all of those things we learned as rehab professionals to do to that setting? And so it differentiates us in that way. The other thing I would say that it really highlights about our team is we care a lot about staying up to date. Kerry was mentioning earlier about evidence-based and what is current and what's in the research, and that's really important to us. And one way that we continue to sort of keep up to date with that is by doing certifications, and those certifications require us to renew them, and so we have to continue to learn, we have to continue to grow, we have to continue to keep on top of this oncology field that is always evolving and changing. And so that differentiates. And then I would say it also differentiates in our hands-on skills. So much of rehab is manual work. We're touching patients. And that's another skill set that comes with having certifications, to being able to sort of know that you have the skill to be able to treat that particular issue or that particular concern, which is very different than if you went to a community clinic where they were sort of treating a joint issue or something like that. We really have to understand how the body tissues are affected by cancer, and that changes, again, our skill set and what we're doing manually with patients.
And similar for us, we're all trained as registered dietitians, so we've all done the internship, we've had experience in a wide array of diagnoses, but we've arrived at oncology because it's our interest and it's our passion. And so similarly, we also have a specialized credential for our team, which is a CSO, or Certified Specialist in Oncology Nutrition. And that's something where the majority of the team either has it or is working towards that credential. And similar to any other credential as well, we do need to recertify. So as Lexi mentioned, that involves continuing education classes, workshops. And then the other aspects of our team are just that we really, and I know Lexi does as well, we like to participate in a lot of outside events, speaking events, trying to figure out how we can really connect with the community. And I know that might be a weird tangent for credentialing. However, part of what we can get is something that's called a fellow of the Academy of Nutrition and Dietetics. And we have a handful of fellows on our team that really just encompasses like a role in research, a role in clinic, a role in professional volunteerism, et cetera. And so it just, again, adds to the diversity of what we bring to the team and therefore what we can deliver to our patient population.
And I just wanted to add that one development that has been recent in the physical therapy realm, I hope that other rehab disciplines get to this point, but it's just been within the last 5 years that we now have a board certification. So there are various board certifications in physical therapy, but oncology is very new. And so that has been just an exciting thing for me to watch in my career, because when I first started practicing, there was not much clear direction for physical therapists. And we've gotten to the point now where we can say we are board certified. And that is just huge because it acknowledges the degree and the skill that is required to treat these patients, and it's frankly what our patients deserve. And so our team is in the process of working through getting more and more of our staff certified, and so that's been exciting for me as a leader to see the value and the emphasis that our team is placing on that. And so we can tell patients that, gosh, you are really getting quality care because your staff have achieved this level of excellence in training that is beyond what we just get out of school. So that's really exciting to see the evolution of that.
I think one thing I would add as well is just that as the team grows in their expertise and as we bring on people who learn more about oncology, get these specialty certifications, it really comes full circle because we have so much confidence in referring patients to Lexi's team. Often they'll come back and say, oh my gosh, I've never had a physical therapist that was so instantly targeted on how to make me feel better. Similarly, I've had patients say, I never knew nutrition could be like that. And so I think it's just that level of, for lack of a better term, like getting it, because we've seen it. We've been here, we do oncology all day long, and I think that's something that's really part of what makes the Fred Hutch experience unique and exciting to work here.